This is Health and Homelessness, Oral Medicine 651, and I'm Ludwig. For the people who are not in the dental school, I'm a second-year dental student. I started this class not because I'm an expert in homelessness, and I don't claim to be, but because I understand the value that that it adds to outreach opportunities. So when you learn about the population you're working with, it adds to that experience. And the most valuable experiences I've had are when, I look more in depth into a population, whether it be dental related or non-dental related, just looking in depth at the population. So hopefully this will supplement your outreach opportunities, and that's kind of the focus of the class aside from the lecture series. So the course objectives. Throughout the course of the quarter, we're going to talk about the social, cultural, legal, and political factors that contribute to homelessness. There are a lot of factors that lead people to be homeless, and one of the speakers will hopefully help you, I think it's the next session, understand what you can do to enact change in homeless policies. Another objective is to understand the challenges and steps for finding shelter for homeless individuals. Finding shelter, whether it's temporary or permanent, is an issue, and there are a lot of factors that go into that. So we'll start talking about those first two objectives today with Kristine. Identify the major oral and systemic health issues confronting the homeless individual in Seattle. I think that's kind of the focus of this class aside from the outreach. What issues do the homeless confront? What do they see that other populations don't, or what do they have more that other populations don't? Access problems for the homeless. Do homeless people have access to health services, dental services, pharmaceutical services, mental health services, and how can they access them? What do they have available, especially in Seattle? And then there's a requirement getting 12 hours of hands-on experience. So it'll be 6 hours quarter. We'll have a couple set up outreach opportunities for people who are not in the school of dentistry. They can participate in those as well. Those are the activities I'll talk about. And then understand how health professionals and different backgrounds work together to the homeless. So this is, you can see, I think we have a couple people here from other disciplines, and it's interdisciplinary. The homelessness is pretty complex, so addressing the issue will take an interdisciplinary group of practitioners. So again, the requirements, we'll have at least 8 discussion sessions available. We may have more. There are a lot of topics, and a lot of people want to come talk. So those will be 1 hour, just like this. There'll probably be food provided most times. The training session, that's yet to be scheduled. At the very best, it'll be an in-person training session. It'll be 3 hours. At the minimum, before our first outreach opportunity, we'll kind of get everyone on the same page and hand out a couple of resources to get everyone ready to participate. And then volunteer activities, which I'll talk about in a second. So the schedule for this quarter, you can find all this information and more, and some extra information about each discussion session on the website, and I use this tiny URL link, Health and Homelessness. So it should be pretty easy to remember. And so if there are any updates in the dates or times or locations of the sessions, just check that, and I'll be sure to email the whole group as well. So this quarter we'll start with Kristine, talking about how does homelessness happen. She's the executive director at Bruce Young Adult Shelter. Next session we'll have Coolidge from the School of Dentistry. She does a lot of research with homeless populations around dentistry. So she and I've interacted with her on numerous different committees, so she's very well versed in homeless populations and what oral health issues they have. The next session will be Nancy Amadei, who's from the Civic Engagement Project, the School of Social Work, Youth Conversation on Homelessness, Health Sciences Students Learning Group, a bunch of different things. But she'll talk about advocacy and public policy and what you can do in addition to outreach opportunities and advocating for them, but making a difference in changing the lives of homeless people. And then the next session will be Don Downing from the School of Pharmacy. He'll talk about pharmaceutical issues in homelessness. He'll talk about medication reconciliation, which is understanding how, if you have different providers, how the medications that you get from one provider might interact with another. And it'll kind of an opportunity for pharmacy students to interact with homeless populations and kind of go through how their medications fit in that. To round out the quarter, we'll have Josephine Ensign from School Social Work. She'll talk about youth and homelessness, and also commercial sex exploitation of children, and a personal story of her experience with homelessness. In spring, it's more up in the air. Hopefully we'll have speakers from the School of Medicine, School of Public Health, and pardon me, I think this is in attendance. There may be more. And so the schedule for spring, I'll post online, and then make sure that any changes to this quarter are also out. And that's going to be done on the website. Yeah. So outreach opportunities, that's kind of an important part of this class. And so I'll go through what current opportunities are in the dental school, and also some of these opportunities will be available to other disciplines, medicine, nursing, maybe pharmacy. I'll see. So we'll start with Roots Young Adult Shelter. We've had at least one event at Roots Young Adult Shelter, and that's open to all students, but currently in place we'll be able to do oral hygiene instruction and distribution of hygiene kits, and just interacting with other professionals. That'll be an interdisciplinary activity with medical and nursing students. Teeth and Toes, many of you might have participated in this last year at Hammond House. Hammond House is a women's shelter downtown, and that'll be interdisciplinary as well. But the cool thing with this is right now there's one scheduled for a few weeks from now, Martin Luther King Day, and the MTI van will be available near there or there. So 3rd and 4th years will have an opportunity to provide clinical care, and 1st and 2nd years will have an opportunity to provide OHI, oral hygiene instruction, and hygiene kits. Centro de Vida is an opportunity with the MTI van in Tacoma to interact with homeless populations. House of Mercy is an opportunity for RIDE students in Spokane that might participate in this class for distance learning, I guess. And that will also, I think, be is that MTI related? No. Yeah. 45th Street Clinic, which is well known, that Dr. She started several years ago, that is open to all years, but most specifically for 3rd and 4th years to provide care directly to the homeless. On the horizon, the Union Gospel Mission Dental Clinic, an affiliation agreement was just finished with them, so hopefully we'll be able to provide care in their dental clinic. They provide a lot of other services at the Union Gospel Mission, aside from the dental services, but introducing students from the school will be important to increasing that. The Downtown Emergency Service Center is kind of on hold right now, but it will ideally screen patients at that center to be referred to the dental clinic at the Union Gospel Mission due to the proximity of the two in Pioneer Square. And the Northwest Career and Technical Academy, this has been a project with Tyler and Luis, you may have heard about, that will utilize resources in Skagit Valley to provide care at some time. So I think that will be coming soon. And our first outreach opportunity will be Martin Luther King Jr. Day of Service on the 21st, and that'll be a teeth and toe style event, so an interdisciplinary event where we can refer, you kind of work within disciplines to give patients more comprehensive treatment. The MTI event will be there, oral hygiene instruction, hygiene kit distribution, interdisciplinary. And there's Jackie Wong. So how big of an issue is homelessness in Seattle? The one night count, which is kind of directs the efforts of the Seattle-King County Coalition on Homelessness. Every January counts how many people are without shelter. So last January, these are the numbers from last January, there were almost 2,600 men, women, and children with no shelter in King County, and almost 6,400 that were in shelters or transitional housing programs. And that, over the 2011 decreased. So it's a pretty big problem. If you're interested in participating in the 2013 event, they may still be looking for volunteers. That event is on January 25th, early in the morning, and the website is right there if you want to go to that as well. So we know that homelessness is a big issue. It's also very complex. So throughout the course of the quarter, I hope we'll talk about how these issues maybe lead to homelessness, prevent people from getting out of homelessness, or are issues when people are homeless. So talk about sexual assault, domestic violence, families with children, substance abuse, overall health issues, mental health issues, oral health issues, chronic disease, consistency in following up with these other health issues, and not only health issues, I guess, but all these. be able to follow up, and then access to care, and then medication storage. So before I continue, I want to put together some surveys. So this is going to give us an idea of what you want out of this class, and then at the end you can kind of evaluate how this discussion session went.
And I do want to stress that we are heavily dental now, but the intent is in our outreach and our field opportunities for it to be interprofessional. And so the questionnaires are focused to get a feel for what you feel right now with working with your colleagues in medicine and dentistry and nursing and pharmacy. And ideally, this will eventually evolve into a multi-school course. So your feedback is really, really valuable on what is working and what doesn't work in this course.
So now I'd like to introduce the speaker. Kristine Cunningham is the Executive Director of Roots, which stands for Rising Out of the Shadows, a young adult shelter in the U District that opened in 1999 as a result of the community identifying a significant unmet need for shelters designed specifically for young people ages 18 to 25. Roots operates every night of the year and is the largest overnight shelter in the city, specifically designed to meet the needs of homeless young adults, providing an integral piece of the continuum of care for homeless persons in Kingstown. Kristine has spoken frequently in the press about the organization and issues of homelessness among young adults. She's been featured on KEXP, KUOW, The Daily, and the Seattle Times. She was most recently interviewed in an article published last week in the New York Times. Please let me introduce Kristine.
I have been working with homeless young people since 1996 here in this neighborhood. And how many of you have an idea why we have homeless young people in this neighborhood particularly? Any hands? No.
There used to be the free ride from downtown and went directly to the U District. That's part of the reason, right?
Nice theory. I like that theory. We'll give you a point for the theory. Anybody else? Why U District for homeless young people?
A lot of church shelters and whatnot are located around here, so they kind of congregate around where they can have a dry place to sleep.
Right, that's a really common theory as well. The interesting news is we had more homeless young people here before there were shelters. Anybody else?
There are a lot of young people in this community.
She's nailed it. A lot of young people in this community. You go to any major college town across the nation, and you're not only going to find college students, you're going to find homeless students. Homeless young people, some of whom aren't students. They're attracted to the youth-friendly businesses. They fit in nicely with their backpacks, look like your backpacks. It's hard to tell them apart from the streets. As a matter of fact, I would say maybe the majority of the people in this room are under 25, am I right? Or am I just being really old? It's the people that I serve, and I have a lot of UW students who volunteer at my shelter, and it's been on more than one occasion that I have gotten them confused because they look the same. As a matter of fact, I have students who stay at my shelter. I got a call from Student Services a couple of months ago for a young woman who is new to campus who couldn't afford the housing costs here. And they said, well, can she stay at your shelter? Like, yeah, she can, but boy, wouldn't that be sad? I can move all the way to come to college and then have to sleep on a church basement floor. So our shelter is very low tech. We have 45 young people who are sleeping on the floor or in bunk beds in what used to be a church social hall. And we invite them in, give them a safe place to stay and sleep, showers, a dinner, breakfast, the opportunity to hook up with case management. A lot of them, though, aren't really interested in big, exciting stuff. Like, they don't come in and say, well, I really need to get housing and hook me up with that case manager right now. You know, they see this as a temporary setback. Oh, well, everything was going fine until I lost my job. Oh, well, mom and dad aren't doing so well financially, and I don't want to be a burden on them. And so I'm just kind of going out and making it on my own. This is just a temporary situation, just like most of the people in this room. They're really out there trying to prove themselves. What's different about a lot of the people in this room is they don't have a mom or dad or safe guardian to kind of bail them out when things don't go so well. An interesting data point came out of, I forget where I read this, in our nation right now, 65% of the college students who graduate are going to move back in with mom and dad. Depressing, right? 65%, and that's just, you guys are victims of the recession more than any other age group. So higher housing costs, higher tuition costs, a more competitive job market, and the way unemployment works is unemployment among 18 to 25-year-olds is the highest it's been since 1948, according to the Department of Labor. Okay, So you guys are actually smart to be in school right now, because those who aren't in school right now are competing with people who have more employment experience for those jobs. So it's good to go get an education. A lot of the young people who I serve at my shelter who aren't community education are really working against a really tough job market. So when we ask them where they come from, who they are, this is what we're learning about them. Okay? So this is, I don't know how many of you can see this trend, but this is a kind of a gender trend. Between 18 and 25, here's the gender trend about females. At the time that they're 18-year-olds in the shelter for the first time, male, female are pretty balanced, but female drops off pretty quickly over that age range, and then male actually increases. And there's a few reasons for this. One is housing females, if you're a supportive housing program, a lot easier. I don't know if any of you guys have lived in dorms, but how do the male dorms compare to the female dorms? Anybody want to guess on that one? Or, it's just like, guys are just, doing some different things at that age and a little harder to house. Not as interesting. Parents are also more likely to ditch their young male. I'm more likely to get calls from parents saying, hey, I'm done with him, can he stay with you? If that person is a male. Which is kind of hard to fathom, but there are parents out there that will do that. Racially, again, the majority of the people we serve are white. Some years, other years it's more like 49%. People who are multiracial or people of color, definitely a lot higher, especially in the Native American and African American. If you are Native American or African American, you are 4 times more likely to be in our shelter than what the local census data would indicate. So you can say, well, why is that? And there's a whole long story about the racial oppression that happens in our education system and our foster care system. As a matter of fact, foster care is the #1 reason that young people are dumped into homelessness. If you hit your 18th birthday while a ward of the state, you aren't given a great big birthday party. You're pretty much shown the door. Because that home that has been having you for 2 months or 2 years or whatever risks losing their license if they keep you past 18. Because their license is based on having a known quantity of adults and a known quantity of beds and bedrooms and everybody passing background checks and, oh, well, yes, I know you've been a part of our system, but we don't want you in the house that we're now serving those other foster kids. That's crazy. So a lot of the young people I know were actually shown the door on their 18th birthday. Many times not even given an ID, not given any money. The state has been very active in keeping them separated from their family of origin for all of these years, so they don't have any connections or contacts with any biological kin. And people who've been taking care of them just kind of cashed in that check and said, I'm done. So these guys are being in the streets at really alarming rates. As a matter of fact, as many as 40% of the people we see in our shelter have had time in the foster care system. If you graduate foster care at 18 without being placed in a permanent adoption kind of arrangement, you have a 40% chance of homelessness in your next 3 years. So it's really a failing of our system. So these are the folks that we serve. And overall, the 530 people we served last year, 75% of them were male. And where are they coming from? There's this myth that Seattle is like this mecca, that people will come from all over the nation just to take part of Seattle rain, and it's not true. It used to be true, actually in the 80s we had a lot of draw, because back in the 80s a lot of cities were being much more militant with their homeless folks and just kind of buying them bus tokens or bus tickets and saying, okay, we're done with you. Where do you want to go? Oh yeah, Seattle sounds nice. Here's a Greyhound, right? That's no longer true, because the federal government is doing this really cool thing called Homelessness Management Information System, where everybody submits their data about how many homeless people they shelter and feed, and then the federal government doles out checks. Oh, well, Chicago, you had a lot of homeless people. Here's your money, right? And so now all of the cities are competing with each other, like who serves the most homeless folks. But you have to look at on your data, not necessarily serve them well. And I would argue that Seattle is one of the few places that has been thinking about young people longer than all of these other cities. So we actually have more services geared towards youth and young adults in this city than in other places, which is kind of great to see. So where they're coming from, this blue is Seattle, and this red is King County, non-Seattle. So again, almost 50% of the people that we see in our shelter are right here, you know, within a bus ride from our shelter front steps. This green is Washington State, whatever is not already accounted for in this part. And then the purple would be outside of Washington. So just so you can do the math, that's 35% outside of the state of Washington. So again, we are not quite the mecca that the New York Times made us out to be. But it was great, you know, to have the New York Times come out to Seattle because they thought we were all that for homeless youth and young adults. And any questions on where these guys are coming from or why they're hitting the streets? Oh, another common one I forgot to mention is gay, lesbian, bisexual, transgender, questioning, queer, intersex. If you are in one of those categories, your chances of getting kicked out of your home of origin double. And your chances of being assaulted once you hit the streets triple. Okay, so these guys are experiencing higher rates of homelessness than your straight population.
Quick question. The people that you serve that are students, not really familiar with the financial aid system, is it really difficult to get enough loans and such to place yourself in housing, to get housing money?
It is. Yeah, as you guys know about the financial aid system, if you're a dependent of your parents, it can be really difficult because your parents still paying you, and then the government asks, well, why aren't your parents supporting your college costs, basically. Most of the people I serve are not dependents of their parents, so they can demonstrate financial need for college, but there's still a lot of lag and a lot of problems. Some of the problems are permanent address. The financial aid system assumes that you have a permanent address until you prove otherwise. So they actually have to get a letter from our shelters saying, yes, they're staying in our shelter. And now, when he talked earlier about the number of sheltered people to the number of non-sheltered people, you had out of 8,800 people, about 2,600 of those guys that weren't sheltered. If you take that proportion and reversed it, that would be true for the young people. Young people are 5 times more likely to be unsheltered based on sheltering data, so it's a little skewed, but than the adult folks who are accessing shelters downtown. When you ask them, where did you sleep last night on their first night in shelter, they're 5 times more likely to name a place unfit for human habitation. So in other words, we have these young people who, the majority of whom aren't sheltered because there's not enough spaces, they don't want to go to the adult shelters. And now the financial aid office is saying, oh, well, you must have a parent or guardian hiding somewhere. Where do you live? Well, I'm living outside, I'm under a bridge. Oh yeah, I've heard that before. How do you document you're living under a bridge? Right? I can't write a letter from my shelter saying, hey, we don't serve them, but we would love to. You know, so it really is difficult. And the students I know that are students, it's pretty quick, usually in the first couple of months after enrollment, whether they make it or not. I mean, it's so hard to be a student and homeless at the same time. They pretty much have to get housing or have to drop out. Any other questions? Okay, let's move on to another thing. I was talking about the recession a little bit. And one of the things that any of you who pay rent understand is that Seattle is a crazy expensive place to live. So 30% of the average median income for King County and lower, if you took all of those guys, put them in a great big building as confusing and convoluted as the health sciences building, and you said, okay, you all need housing, right? And you said, okay, well, this is how many rooms we have for each of you. You'd have a ratio like this. For every 233 households, you'd have one place to live, one housing unit. That is the number for King County. Okay. And so it's not only that we're picking on young people right now, we're picking on everybody who's in what we consider poverty level housing. Okay? All of the development, all of the retail, all of the new units, even though they are developing new rental units, are all going towards upper and mid income. And so this is happening all across the nation. Seattle's not alone in that. According to the U.S. Housing and Urban Development, we have, for every man, woman, and child who's homeless in this country, we have 20 empty housing units. So we've got enough housing. We just have housing that's way up here in the affordability ratio versus down where these folks need it. So, you know, they're doubling up, they're couch surfing, they're sleeping outside, they're sleeping in cars. One person estimates that been working with estimates that 30% of the homeless population is actually living in vehicles. And they often aren't on the one-night counts and below the radar because they've gotten really good at finding places that they can park discreetly. So we have this huge problem with housing provision among our population here in Seattle and all over the country. And what that means is basic needs like dental hygiene just get put off, especially with young people, because young people have this idea that they're, well, let's face it, immortal, right? Like there's nothing that's gonna happen to me. I'm young, I'm strong. This is my time to prove myself. I'm tough, right? I had a bunch of public health students come in and do a case study with me last fall. And what they were asked to look at is why are youth and young adults who live on the streets less likely to access health care? Because I see these guys with gaping wounds and breaking down skin and really bad dental deterioration. And you say, well, why don't you go get care for that? Oh yeah, well, no, I don't want to. Or whatever, yeah, they come up with all these great excuses. Oh yeah, well, I'll do it tomorrow. You know, and there's something going on here. We gotta dig on this one a little bit more. And what they found out was that the women that we serve are, accessing care at a pretty normal rate and taking pretty good care of themselves. But guess what those young men are doing? I'm tough. I don't want to look like a wuss going to the doctor. I'm going to show my friends that I can tough it out. So what if it's a broken leg, right? And they're doing all of this crazy stuff and showing up with gaping wounds. It's almost like battle glory kind of stuff, and it's crazy, and people are dying. And they're having long-term consequences. I know people who are no longer ambulatory after a few years of living on the streets with debilitating illnesses, upper respiratory infections, skin breakdowns, dental. I mean, those are the #1 causes. Oh, and traumatic force, traumatic injury kind of stuff. And these guys are really struggling health-wise, have a much higher rate of infectious disease as well. So it's really sad to see them having to do this kind of hand-to-mouth existence that basically means long-term needs that you have past tomorrow, just get put off day after day after day. This is a little bit about housing prices, college prices. The gap between the juvenile justice system and secondary education and your capacity to access services as a young adult. And also Washington State is the hardest place to get a valid ID, one of the hardest states in the country to get a valid ID, especially without a permanent address. So these guys have a lot of environmental factors that are working against them. So even though they're very motivated to go out there and prove themselves in this world of hey, I'm an adult now, they have all of these things externally working against them. But the cool news is that doesn't stop them. Here's a list of questions. One of the questions we ask them is, what are your goals? And you would expect they would say, oh yeah, I need to get housing. I need to get out of this place, right? Because they're literally sleeping on the floor. And their #1 goal is job or career, 39%. Very motivated to what they're moving toward. And you ask them, oh, okay, what kind of job, what type of career? You're expecting that they're going to say day laborer, blue collar kind of stuff. They're saying like, I want to run a restaurant and I want to be a philosophy professor and all kinds of crazy big dreams that are just really amazing. And I have seen people do that. I have seen a lot of smarts, a lot of talent, a lot of amazing capacity in young people, even though they didn't have the best high school education and they didn't have a lot of concerned adults in their corner. I've seen them overcome amazing obstacles without the supports that I had at that age, and it's really inspiring to see. The next common thing is housing. The place is 27%. Education is 14% for these guys. And a lot of them are talking about, again, long-term goals about like owning their own business and some type of giving back to the community. One thing about homelessness that happens for young adults that a lot of mainstreamers don't get to see is they get very connected to other members of the homeless community. I mean, like when we have a full shelter, we do this thing called the lotto. We put a bunch of numbers in a bucket, we draw out numbers and say, oh, sorry, you didn't get in tonight. Okay, here's a blanket, here's a bus token, good luck, right? And so he's gonna talk to his other friends, and they're all gonna gang up and go sleep under a bridge somewhere together and keep each other safe. That's really common in the homeless community because it is life or death. You know, you really learn what it means to have somebody watch your back. And it's a form of loyalty and community that is just beyond our experience. The only thing I've seen close to it is members of the armed forces. You know, my brother serves, and he came back and just saying, the way he talks about his unit is the way these guys talk about their street friends and their street colleagues. So it's pretty interesting. So, how does this relate to questions you guys have? I would love to hear from you all.
With health concerns in mind, do you have data on substance abuse and how that affects?
The only data I found on substance abuse, there was a national study that suggested that it wasn't as common at the time of the first incident of homelessness as we would suspect, but that it gets much more common over the long term. So I think it was something to the effect of, as a causation of homelessness, it was only 12 or 20%. It was like a really smaller number. But then over long periods of time, the longer you've been on the streets, the more likely you are to develop an addiction. And you know, I've asked around the shelter about that. I was like, well, I know you're associating with people who use, but what excuse could you come up with for why use would be more prevalent while homeless? And his answer to me was very blunt. He's like, well, it's friggin' cold outside, and if you're sleeping in a place that you're getting messed with and woken up and harassed by the cops, it gets a little more pleasant if you're drunk or stoned or whatever. I mean, he was very blunt with me about that connection. There's also the other thing that is somewhat controversial and not really proven is the prevalence of having a major college campus as far as there's always willing customers to buy pot, right? And are the homeless people a part of that? And I know some that are. So I think that could be a part of the connection with homelessness and drug addiction. At least when meth was big in this neighborhood, it was common practice for those that were dealing to get people hooked on it to kind of encourage their loyalty. So you're gonna, like, whoever is like moving your product for you, you want them to be hooked because then they're gonna be a lot more dependent on you as their dealer.
Sort of in a different direction, you haven't talked much about like mental health and its correlation to homelessness.
It's very similar actually as far as not the normative causative kind of effect, like, oh, you're mentally ill, now you're on the streets, right? That's much more like, oh, the longer you're on the streets, the higher your rates of mental illness occurrence will occur. I'm sorry I don't have the exact numbers on that, but we also have seen a defunding over the last 30 years of housing specifically for people who are mentally ill. So, I mean, at this point, you pretty much have to be severely mentally ill and med compliant to be able to have publicly funded housing. Everybody else is like, oh, well, yeah, just check in with your case manager once a month. You're good. You know, like the guy who did the cafe racer shootings, that was kind of underreported about how much mental illness was a part of his plight. And I talked to people who knew him who said, yeah, he was actually trying to get mental illness support and was not successful because he didn't have income.
How many of the homeless youth end up being homeless over their lifetime? Like it's not just a temporary thing.
Right. I have data that is from older folks looking back. Like when you ask people who are 40 plus, how many of you experienced homelessness when you were under 25? 50% of them say yes. Okay, so we see that connection from years ago, that there's some predictive factor, but I don't have data that follows current homeless youth, you know, for years to see how many of them experience homelessness repeatedly. It is an interesting question because all of the federal government's love of data right now, they're basically saying hey, we won't give you money unless you can show us that data, unless you can show us the recidivism of homelessness. So, hey, Kristine, at your shelter, if you serve 530 people this year and 400 of them come back next year, then you're doing a bad job. We don't want to give you money. So everybody's like wanting to see that data, but we don't have a long enough period to have good numbers on it. Good question.
What do you do at your shelter to help address your clients' healthcare needs?
Not enough, frankly. You know, it's really a tough balance because this is their living room. This is the place that they sleep and hang out with their friends and watch a movie, and it's really annoying to have people come in and say, hey, I'm the public health nurse, I want to talk to you about your health needs. And it's like, the mornings work a little bit better. Sometimes I can circulate some information about, hey, did you know such and such clinic was open today? Yes, you can go take care of stuff. But what that public health student case study found is that this is a very private conversation. People don't want to have this in this milieu of all of their peers. If they're going to access their healthcare needs, they want to do it discreetly and in a way that doesn't make them look weak or less than tough. And that sounds really superficial, but when you think about your street cred is the difference between having your stuff jacked or not, right? You will get your stuff stolen if you look weak, if you look like somebody who's like, you know, really worried about that infected wound on your neck. Wow, well you're a pretty easy mark. So it kind of makes sense that we wouldn't have good luck because we have invited healthcare providers into our shelter before and everybody just kind of collectively ignores them. But it's interesting because when they have been at our shelter, they've saved lives. Like we are lucky enough to use work study students. And if any of you have work study, come find me. One night we had a gentleman who overdosed and came to shelter to die. He did not tell us that he had overdosed. He just signed in, got on his mat, and passed out. Because she was a trained medical care provider, she knew that his breathing was irregular. And I mean, to have ears that tuned in a room full of that many people, to walk past somebody and say, you're not breathing right. Bent down, did a sternum rub, called 911, got him medical attention. If she hadn't done that, he would have died, right? Which is like giving me chills because no one's died in my shelter yet. It's like, but you know, if we hadn't been lucky enough to have her there that night, that would have happened. And so the need is really there, clearly, but how to bridge that gap is something that we're still struggling with. And one of the things that came out of this case study was, Kristine, you need to get nurses who the young people know and trust, who they see regularly, who can be at your shelter regularly, and they can have private conversations with them and make sure that somebody's kind of encouraging them. Because once they make it to Harborview or these public health clinics, they're not always treated well. I don't know if any of you have ever, you know, been on the poor side of the tracks and tried to get your healthcare needs met, but it's kind of like a cattle call. Is you're not always receiving the most attentive, smiley, compassionate, best of care, and because you don't see the same person regularly, there's not the preventative focus that there should be. So I've got a few conversations going with different practicing nurses to try to set that up at my shelter. If people are interested in joining our little club of like, how do we figure this out, it's really a need. And I've got cards that I'll put out for folks to follow up with me about that.
You sort of indirectly promote healthcare with 7 reservations for 45th Street for Wednesdays and Thursdays.
Yes, yes, she raised a good point. One of the things we do for people who sign up to go to the 45th Street Clinic Wednesday and Thursday, we'll hold them a bed. So in other words, we allow them to surpass that whole random drawing thing, which makes it even more exciting to go get your healthcare needs met because, hey, guaranteed in at Roots. And that was really important to us, that we wanted folks to make sure that they weren't making a choice between a safe place to sleep at night or healthcare. Other questions?
What time do they have to be to the shelter?
Sign in is between 8 o'clock and 8:30, so they can call or show up to get their name on the list. And then if we have too many people at 8:30, we'll do the random drawing that we call lotto. And then we'll announce who doesn't get in at 8:30, and at 9 o'clock we'll start calling in names. Everybody's pretty much in by 9:30. We have 45 guests who sleep there every night. Over the holidays, it was more like 35, which was kind of nice. Some people were able to go home for the holidays. And then in the morning, everybody's out by 8 a.m. except for Saturdays, they get to sleep in until 9.
Where do your clients go during the day?
It varies. Just like you saw the really varied demographic and interest kind of data, some of them are going to college, some of them are going to jobs. I would say more college, more jobs actually than when I started with Roots almost 5 years ago. So the recession again has kind of brought out these folks who normally would be able to afford a place to live. Some of them will go to the library. I don't know if you guys have ever heard of Snoozewallow, referred to as Snoozewallow, but you'll hear that referenced every now and then. Some of them will just ride the bus, just hang out. The daytimes, there are some drop-in programs that are open for homeless young people here in this neighborhood. Not as many as we have homeless young people, but enough to handle a good 20 people. Weekends, not as many programs for them.
How many beds do you have?
45.
Have you observed the general attitude of brushing teeth, and do you have the means?
Yeah, we have, thanks to the local dentists, we have all of the toothbrushes and toothpaste that anybody needs. And we also have Urban Rest Stop running in our place Tuesday through Friday, which they also give out toothbrushes and I don't know if you call it toothpaste, but you just kind of pour it on your toothbrush. And like they have the disposable toothbrushes. So that is definitely there for everybody who wants it. Yeah, we don't actually toothbrush their teeth, of course. From my observation, I'd say probably about half of our guests are pretty diligent with that. But again, it's really a lack of long-term focus. By the time, for a lot of these guys, that their dental needs are very present for them, it's like an abscess or like something really painful that is interfering with their capacity to eat.
Is there a transition program at all for foster children from 18 to like acclimate?
Yes, there's some programs that have been doing a lot of great work around that. One of them is actually advocating that our state adopt foster till 21 as a mandate. So in other words, that people get 3 more years. There's also some programs that through a private foundation, making sure folks have free college until 21. There's the mandate that these caseworkers are supposed to be doing exit planning with young people before they hit 18. But having that on the books while you still have like a 75-person case ratio is really not working that great. One organization that's really great to check into if you're curious about that is called the Mockingbird Society. They've been doing a lot to reform foster care and set up more of a kinship model for young people who are coming out of foster care. All right, any other questions? You guys have been great. Thank you, and I'll put out some business cards, so feel free to follow up. We also will have some brochures after.